Well, by all accounts, a vaccine for COVID-19 is being worked on and hopefully on its way. But whilst we all wait for that, we still need to treat those with the virus. And Dr. Francis Pitsillis has done some research on the researchers to find out what the potential community-based treatments are right now. Good morning, Dr. Francis. Great to see you.
Lovely to see you too, Carly.
Dr. Francis, what made you decide to look at what is in the research as potential community-based treatment of COVID-19?
Well, I think it's really important that people follow their doctor's advice, have a test and follow what they're told, what to do about this, and don't try and treat themselves. But what I think I wanted to convey today is my interest in seeing what the researchers were saying and doing and what they're sort of starting to come up with, especially as some people have been suggesting certain things.
And we're not necessarily talking about prevention here, we're talking about if you've got COVID-19, what you can do to help get out over it faster, I guess. What did you find out?
Well, it's important to not to say to people go out and do this necessarily, but what I did find out is there's three areas that people research in. They look at natural and community-based treatments, they look at hospital-based treatments, and they look at intensive care. Now, when it comes to community-based treatments, ideally you really want gold standard studies, and these are the ones that are quite large, where they compare the treatment with, or the new treatment with a placebo. In this case, in the COVID environment, they're really going to be talking about good standard accepted treatment versus standard treatment plus something else to see if that something else is extra. And in the meantime, we've had some smaller studies, and one of them has been on vitamin D. There's been two that have come out very recently that are very, very interesting. One of them has been published in the Journal of the American Medical Association, which is quite prestigious. And they had 489 people, and what they basically worked out is that you've nearly got double the risk of getting COVID-19 if you have low vitamin D levels. So that's the sort of general conclusion that they came down to. Now, this doesn't mean that everyone should rush out and take vitamin D. It is important to talk to your doctor about it and have a blood test, because you could actually poison yourself by taking too much vitamin D.
We talk about things like vitamin D and zinc and vitamin C. So does zinc feature in any of the research around potentially getting weller faster from when you've got coronavirus?
Yes, it does. In fact, it's a major player. Zinc on its own has got immune enhancing effects. It works on both sides of the immune system, and the main way that it works is that it stops viruses from replicating, from duplicating themselves, but it also reduces inflammation. And the researchers have noticed that several drugs actually work to get to get the zinc into the cell. So it's about using zinc with some of these drugs as well as on its own having an effect.
You know, health's always such a puzzle, isn't it? There's often no one remedy that fixes everything, and that's why you're an integrative medical practitioner, because you look at the holistic picture. Around the world, people are racing to come up with a vaccine. We're racing to feel well again. It's going to be, you know, a real puzzle, a real global effort to figure out what is the best case scenario for treating coronavirus. Is it some of these drugs combined with some natural supplements as well?
Well, yes, it's very, very interesting, because not only, as I mentioned, are they talking about hydroxychloroquine, which is really a hospital-based drug in a lot of places, combining with zinc, but they're also now talking about other things combining with zinc. And what's happening is that in poor countries where they haven't got a lot of money, they're finding new solutions. For example, people are looking at repurposing, finding a new use for drugs that we already have that we know have antiviral action. So one of them is doxycycline. Now, you might think, oh, actually, that's for my teenager's acne. You're quite right. It's for teenage acne, it's for chest infections, sinus infections, but it actually is an anti-malarial, an antiviral, and an anti-typhus drug. And it does reduce inflammation. It's safe over the age of 8, and it acts within hours. So they've been using that along with other things. Now, I want to tell you about a trial, which is not a gold standard trial, but it's an observational trial whereby they actually observed 100 people in a row in a Bangladesh hospital in July, and they put it together in July this year. What they did, they were aged 8 to 84, and they gave them doxycycline and something called ivermectin. They gave them a half-strength dose of doxycycline and 1 dose only of ivermectin. They had different degrees of illnesses, and they found that the mild to moderate people got 50% reduction of their symptoms by day 3 to 5. The very severe patients were 50% better by day 7. None of them needed intensive care, and there were no deaths.
As long as everybody's competing to try and find out what the gold standard treatment is for coronavirus, the better. It can't come soon enough. Finally, Dr. Francis, in your research, what does it say about risk and lifestyle factors?
Well, the researchers have reiterated advanced age, minority groups, obesity, smoking, chronic diseases, immunosuppression, cancer, smoking, and they also talk about anything that keeps your health optimized. Enough sleep, diet, stress management. Keep yourself healthy at all times.
Thank you, Dr. Francis. And of course, we urge anybody watching this morning that is experiencing any flu or cold or coronavirus like symptoms, you do need to go and have a test and talk to your own health professional. We'll see you next week, Dr. Francis.
Thanks, Carly.